We'll just wait for a few more people to arrive and then we'll start shortly. Just thanks for joining us so far. Just let a few more people join in. Then I'll start when you give me the thumbs up, Nikki. Okay, so I've been given the thumbs up. Welcome everyone. Thanks for joining us this Friday morning. This is a 1-hour webinar, and it's hosted by Epilepsy12 and the Royal College of Paediatrics, and it's going to be delivered by the Association of Young People's Health, together with representation from young epilepsy. So I'll just start with a little bit of housekeeping, just so you feel settled. I'm Colin Dunkley, paediatric consultant based in Sherwood Forest. This is in a webinar format, so if you're participating, you'll find that your cameras have naturally been switched off and you're muted. The session will be delivered through shared slides, and there'll be chance within the slides to contribute and interact through Menti throughout the hour. And then at the end, there'll be chance for question and answers, and we'll do that through the chat function in Teams. It's a recorded session, so if you want to watch it again, there'll be a chance to do that afterwards, or if someone's missed the webinar, they'll be able to see it at a later date. So I'm the clinical lead for Epilepsy12, and typically we have been an audit for England and Wales that measures quality of care and then tries to improve things. And our main outputs have been reports and numbers and other system type information, but increasingly we've been trying to do things differently and hear the voice of young people with epilepsy. And then not only do that, be directed and driven by that voice. So this webinar is a step in that direction, and I think we've got a long way to go. Recently, we've been heavily influenced by the core 20+5 agenda, and that's making us think differently about who we're hearing from and who we're reaching and who we're serving. And we've been pleased that epilepsy is represented as a specific health category within that agenda, particularly those with autism and/or a learning disability. This project particularly has been around hearing voices that might otherwise go unheard and allowing them to directly influence their healthcare. And we're going to hear from the most recent iteration of the project, where we've tried to connect those voices directly to local services and see what happens. So this is about me standing out the way, the epilepsy team standing out of the way, and trying to connect on the ground and see what happens. So it's a little bit like losing control, but I think that's good, because I think some of the powers at play are too much in control, and we have to change things a little bit. So I'm going to hand over now to Nick, who's going to introduce the session and the team, and then I'll go quiet, but I'll pop up at the end and help with the questions and answers. So thanks very much, and over to you, Nick.
Brilliant. Thank you very much, Colin, for your kind introductions, and welcome everyone to our webinar this morning. Happy Friday, happy December. I hope everyone's week has been okay. So as mentioned, today I'm going to be presenting on some of the work that we at the Association for Young People's Health are currently doing in commissioned by RCPCH Epilepsy Audit 12 team, and in partnership with Young Epilepsy as well. So without further ado, I'm going to share some slides to kick us off. Just bear with me a second. Here we go. So yeah, as mentioned. So yeah, embedding the learning of young people with epilepsy from marginalised communities. And I'll go into detail a bit in a minute. So as mentioned, my name is Nick Morgan. I'm the Youth Engagement and Partnership Manager at the Association of Young People's Health. And I'm joined today by Emily, who will be sharing a bit more about herself in a moment, who is one of the several young project advisors from the organisation Young Epilepsy and their Young Epilepsy network. Can you give us a wave, Emily? I think your camera is on. Hello. So just a quick one on who we are, though. As an organisation, we work to understand and meet the particular health and wellbeing needs of 10 to 25-year-olds. We want all young people to have the best possible health and equal access to high quality, youth-friendly services. We do this in a variety of ways, primarily these four you see at the bottom. The aims of today, we're going to do a brief overview of the unique challenges faced by young people with epilepsy from marginalised communities, or as Colin mentioned, people who might be not heard from or unheard, not have their voices so much in the mainstream, let's say, of society sometimes, for varieties of reasons, and to start thinking about innovative and appropriate solutions to engage in young people diagnosed with epilepsy who are from these communities, and what we can do as a society, as a community, but in particular as healthcare professionals, what can you do and your services do to engage these marginalised communities better in your services? But before we jump into that, I am going to hand over to our young project advisor, Emily, who's going to just simply introduce themselves and share a bit about their experiences and why they got involved in this project earlier this year. Emily, over to you.
Hello, let's hope you can hear me. So obviously I'm Emily. I was diagnosed with temporal lobe epilepsy back in 2019 when I was 15. So a bit of an awkward age, terrible in my opinion, because I kind of knew everything that was going on. And I'm currently in my final year of university somehow, surviving, studying adult nursing, and getting involved in this program and this whole project was huge for me, because marginalisation within the education system for me particularly has been huge. Every step of the way I've had to fight, and I've had to have so many meetings. 4 people's meant to be turning up, and then I've had 12 there, and they take turns telling me why I shouldn't be doing this, why I should be doing this, and getting involved in any way that I can to kind of bridge that gap and stop that other people with epilepsy experiencing that. I'll do it. Count me in. So yeah, getting involved with anything that we possibly can to stop other people with epilepsy going through the same, and just creating more emphasis on epilepsy. I think it's nice to finally start seeing things come up, around in the public eye a bit more, because before, when I was diagnosed, you couldn't actually find anything anywhere, and you kind of had to scour the internet to find things, whereas now you kind of slowly are starting to see things. So getting involved in these projects kind of bring a bit more awareness around, and you start seeing them. So that's very nice. Thank you.
Thank you, Emily. I'm going to ask you a question, which we might not have prepared, but I'm hoping it'll be okay. So Emily was very, very kindly joined me in person in Durham last week, which I'll talk a bit more about in a minute, where we delivered a 3-hour session in person. Emily, what was kind of one of the biggest things that you remember from that session that was discussed a lot, or you thought was really interesting? Does anything spring to mind?
I think for me was how much work all the healthcare professionals are really wanting to put in the services to bridge this gap of marginalisation for young people. I think it's been identified through projects like you guys have completed, how much of a difference needs to be made, and all these healthcare professionals are kind of identifying how they can start to make those differences. I know, for example, there was discussing the kind of services gap between the ages of 18 to 25, and that sounded incredible, because I think that really would help within the ways, for example, the education side of it. That would have helped me massively, having that kind of interconnect system, because I had to get my doctors involved crazily in getting me to university. So seeing that they were already kind of creating steps around it was incredible. I think we're already on the way there to kind of battling this off. So that was a big one.
Brilliant. Thank you, Emily. I won't put you on the spot any further. So Emily will be back with us at the end. So myself and Emily there'll be a Q&A at the end of today's webinar. And I might ask Emily to reflect on some of our Mentimeters, but thank you very much, Emily, for sharing some of that. I'll go back to sharing my screen. There we go. So as mentioned, so last year we were commissioned by RCPCH again to do a report, and we did this in partnership with Young Epilepsy, the Race Foundation, and RCPCH and us, and ran sessions with young people across the UK who have a diagnosis of epilepsy and have experienced marginalisation in some way, shape or form. And that report and findings was delivered and published at the end of last year. This year, we were commissioned again to use that work to embed the learning, as the title has been called, by creating and running practical workshops and resources for professionals based on the findings from that report. We have done this in 2 trial sessions, which we did last week, as mentioned. One was in Cambridge, and the other one was in Durham. It was a free workshop for professionals in that area to attend. And this work's been co-produced every step of the way. So Emily, as well as approximately another 9 to 10 young people as part of Young Epilepsy's network of young people, have joined our kind of team and have helped create the workshops. They've helped create videos, come up with ideas and narratives for videos that should come. And what's been really highlighting for me is the fact that, you know, Emily mentioned in her talk there that when she was first diagnosed, there wasn't a lot of conversation or awareness about epilepsy. And almost I feel like this piece of work has come at a time where, okay, so now epilepsy is more broadly kind of known about, and young people are kind of learning a bit more about it. And the next step now is obviously to think about, right, what communities and people are missing? Are we not engaging maybe as well as we could be, are missing out on the right healthcare, whether it be for for what might be a numerous amount of reasons, and what we mean by marginalisation, which I'll touch on in a minute. And so that's been really enlightening from people like Emily and other young people who have been there when they were having to just initially try and talk about epilepsy just generally and not have to worry about those other things, whereas the other parts of it are coming to it now, and they are able to give that kind of experience of feeling different and what that might have been like at the time, and help move this project forward. So just as a live bit of feedback, so we had some feedback from our sessions last week, which will come into a report at the end of later this month or beginning of next year. And it was all positive. It was really well facilitated, engaging and interesting. Group activities and meeting young person with epilepsy was one of the highlights for both sessions. And the group activities were very engaging. I got the opportunity to meet professionals from other areas. So that was something as well they were all really excited about, was just meeting their other team members from different parts of that wider sort of integrated care board area or some sort of geographical area. And it was really good to hear. It was nice to hear from young people with epilepsy and to hear their experiences as well, as mentioned. And so one of the key things with these workshops that we will now tidy up and fine tune based on the feedback we got is that they have to be delivered with young people. There's no way around, you know, the impact the young people had. If you look at the rest of the feedback, there's a lot of that. That's the main kind of focus. That was the main thing that helped them feel like they needed to change or wanted to change and what to change. So that'll be in the workshops as well. So I'm going to, I mentioned videos. So I'm going to share one of the videos that we've made so far. We've got a couple more coming up that are still being edited, but this is just one video that's been created using quotes and audio from the report last year. Apologies for that, everyone. Don't know what's happened there. Okay. So in typical IT fashion, this has been working fine in previous iterations of us testing this, or me testing this as well. I'm going to move it, but there was only a minute or two left, and I know that it's having difficulty now to load altogether, but hopefully you got something from, there you go, that video. That video is quotes used from the report last year, where we got some of our young advisors to read out said quotes from young people quoted last year. And we're also trying to put together some other videos of young people specifically talking to camera. So watch this space. So as the youth engagements and partnership manager, it wouldn't be a webinar of me presenting without there being some audience participation and engagement. So yeah, so as part of today, there's going to be 2 Mentimeters. I don't know if you've used Mentimeter before. This is a live tool, which I'll go to in a minute. And before we move on, I just wanted to ask you all, what do we mean by marginalisation? I want you to think about what words come to mind when you hear the marginalisation, when you hear marginalisation. This is one of the questions we asked in the training. So if you go to www.menti.com on any browser, you can do it on your phone, on your laptop, and type in the code 74161026. You should then be presented with a question. Oh, maybe not. There we go. What does marginalisation mean to you? What words do you think of when you hear this term? You can put as many answers as you want. The idea is that there's no definitive term. Whilst you're doing this, one of the key parts, of the work we did last year was trying to establish what we thought of when we thought of marginalisation. It's quite a broad term, and we didn't want it to be too we didn't want it to be prescriptive and black and white. So we did work around it, because marginalisation is something that you can feel regardless of your circumstances. It's not a defined, definitive thing per se. So this is a nice little word bubble. So the bigger the word, the more it's been said. So you can see isolated and excluded, unheard, barriers coming up a lot as well. And then if you start looking around the kind of periphery, if you will, you can start to see other parts of this work coming up. So unrecognized, struggle, sidelined, hard to reach, language barriers, excluded, feeling different, poverty's there as well, disability. Yeah, we're really getting into the nitty-gritty now as more and more come in. Isolated still remaining the biggest kind of word alongside barriers as well. Brilliant. Inequality. Thank you. Okay, so exactly, this is intersectionality is up there as well. Brilliant, which is what I wanted to highlight as well. So when we did this activity last week, there were almost sort of 2 types of answers were given. One was similar to what you've got here. So isolation, barriers, unheard, exclusion, segregated. And then the other set of answers were specifics around disability, intersectionality, race, ethnicity, religion, language barriers, additional barriers. We could say additional needs, right? And of course, all of which are completely correct. I'm going to go back to the slideshow to kind of show what we use to sort of talk about it, but thank you for engaging in that. And as I mentioned, you know, it's all right, and you all kind of sort of get to understand this. So we'll come back to Mentimeter later. So for us, when we were working, what we were looking at or targeting, you know, the work that we did and the groups that we looked to engage with was specifically about those who are diagnosed with epilepsy and have other elements of their intersectionality or their circumstances that impacts their experience of care. And this can be, but was never limited to, you know, identifying as being from a global majority background, so Black or minority ethnicity, identifying as LGBTQ+, being neurodiverse or having a neurodivergent diagnosis, living as from working class or low socioeconomic communities, and also living when English isn't the first language. You know, we spoke to many parents in the report that we initially did as well, that's talked about that having to get sort of broken translated conversations with the GP about their son, but from their son who's also trying to understand scientific language that you might be using unintentionally because that's how you've learned it, and that can also be quite hard and confusing. So thank you for that. So I'm going to go through the report presentation now, which was the findings from the report that we delivered. So yeah, as mentioned, we published an engagement report and a literature review as well last year, where the literature review looked for good examples of youth engagement work with especially from young people from marginalised backgrounds. But generally, we were looking for any engagement, kind of extra engagement work that was being done. And, you know, because there isn't a lot of that sort of work that gets reported, and that's not just in the epilepsy field, that's in kind of youth engagement work generally. We're not great at reporting or writing up you know, work that we've done to do that type of thing. We also released an infographic, which you can see on the right, a poster of infographics, if you will, which shares the themes that came up in improving understanding and improving the offer. Why is this important? We know, or you especially, I imagine, if you're attending this, know a lot of this. One main to think about for us, though, is that children and young people from these groups are more likely to experience marginalisation, may struggle to access services they need, and may have poorer health outcomes because of it. At the Association for Young People's Health, we do a lot of work on health inequalities generally, and we know that these marginalizations do impact and present lower health outcomes for young people, whether it's in being from a particular community, or not having enough money to get the bus, or not going to get healthcare because you don't feel that they get your gender identity. All of these things can impact a young person's ability to get good healthcare. So who did we speak to? We spoke to 48 children and young people across all 4 nations of the UK, which I'm always proud to say. Being a Welshman myself, it's always nice that we managed to cover the whole of the UK. An even split for young men and young women. Just under half of young people identified as being from a range of ethnic backgrounds, including Black British, Pakistani, Bangladeshi, and mixed ethnicity. Several young people identified as LGBTQ+, and young people with a diagnosis of various neurodiverse conditions. Our children and young people varied in age, with the youngest being 11 years. I keep forgetting to change that. 11 years, not 11 months. But they were supported by a parent, but the oldest being 25. And the majority of young people were aged between 15 to 25 that we spoke to. These are some of the messages from the engagement. And the interesting thing about these might not necessarily be specific things that you haven't heard before. However, in the report, you know, we talk more about how these things are kind of amplified in marginalised communities. And so thinking about it from that lens will help you kind of think forward about how you might or could potentially change something around the work you do to engage different communities. So, you know, we talk about reducing stigma and raise more awareness around epilepsy in young people, and improving an understanding in different cultures and religions, especially for parents. You know, lots of young people were telling us that type different cultures and religions have experience of or don't quite understand epilepsy or don't want to understand it. And a staff member last week shared an example of a family they worked with, and not to go into too much detail, but you know, who talked about it having the devil in them, for example, which is an extreme case, but that is something that happens and gets discussed. Tailored communication for young people, including ensuring translation services are available. So the tailoring communication for young people, I imagine, is something that's been talked about for a while, but including translation services are available is really important, especially for younger children whose parents don't speak English. You know, having a young person trying to translate what exactly is going on isn't always the best way to kind of engage in that situation. I know it's not easy to find solutions, but that can have or does have an impact. Remember that isolated and excluded young people can benefit from peer support and group work. So this one was really interesting. I think one of the things that came out with that wasn't necessarily young people asking for, oh, I want a really specific LGBTQ epilepsy youth support group. It was a lot of them. I think it was on the flip side that they wanted to meet any other young people with epilepsy. And because especially if they are maybe not as able to talk about it so openly in their own community, whether that be a religious community or a working class community or other community. So the idea of just meeting any other young people around their age with epilepsy and being able to talk about it, the difficulties, the highs, the lows, you know, can be really beneficial. And that's something the young advisors talked a lot about with Young Epilepsy's Youth Network, and how useful that is just to be able to hear other people's stories of going through certain things and even being able to then laugh about some of the difficulties that they face, because it's something they have a shared, you know, understanding. Not that it's a laughing matter, of course, but hopefully you understood the message in there. Help young people to manage an uncertain future, particularly at transition into adulthood. Again, this won't be something you've not heard before, but again, thinking about it from a marginalisation lens, you know, I think maybe using LGBTQ as an example about having that consistency with pronouns and sexual identity and sexuality, acceptance, and those sorts of things can be really beneficial, but also ensuring that depending on where young people's communities are and what their opinion and awareness of epilepsy is dependent on how much support they will have going into adulthood, if that makes sense. And lastly, more could be done to support young people with accessible tools and simple technology. A lot of talk was, I think, come up with young people wanting to have something that they could record their any seizures and things like that on, but also have it being a direct kind of link potentially to their consultant or to their GP or to their nurse or whoever is their kind of main contact, and that in turn will help them to, I guess, have a bit of autonomy about doing that and not worrying about having to bring up certain things in front of their parents, maybe if they didn't want to as well. Again, linking back to any stigma or in different cultures and religions and how they face it. So some messages from the work. Parents not understanding the health condition. It's very hard to explain to others as her condition can vary. There's mixed and different symptoms. Parents, school, not always sure due to condition. Does not speak, so can't say how she is feeling. So that comes from a parent that we spoke to. And I think that was another side of it, you know, like a parent in a community where maybe they don't feel comfortable or able to share with their parent group or their community, their family, what's going on for their child was a big worry from a stigma point of view as well. So you got that extra layer. I get a lot of stigma from the community, and it does annoy me a lot. Out of about 100 people in that community, I would only tell 20 people about my epilepsy. So that came directly from a young person of a particular religious community. To me, the biggest worry is just about living on my own. I'm obviously with my girlfriend now, but if we split up or something happened, I'd have to live with my mum and dad until they're really old, and then I'll be out on myself. I won't be able to live on my own with this. I'm having to get Ubers, and it takes away your independence. So that was, again, from a young person. And lastly, they speak to my parents rather than me, even though I understand. And that is directly from a young person for neurodiverse diagnosis. Yeah, which wasn't the only time we heard that conversation coming up. So some specific recommendations from young people. One was to improve the range of information for different ages and young people from different communities with different needs. I think being aware of what different communities and different needs are is maybe something around looking at what are the communities in your geographical area, let's say. Who are the people that you are working with and who are not the mainstream, and how can you reach out to those a bit more. Increase opportunities for young people with epilepsy to work with their peers and help co-produce solutions. So this is a co-produced project, and there's something about, yeah, that in itself can be quite supportive and working with other young people with epilepsy. But as you heard earlier, you know, peer support came out quite a lot from almost all young people that we spoke to last year. So I think it's important that everyone kind of has a think about how that could potentially be facilitated in some way, shape, or form. You know, I know in some services they have kind of youth advisory boards for particular services and that sort of thing. And maybe there's something around having something like that for epilepsy in different geographical areas. Just an idea. Introduce stigma busting and awareness training in the communities and schools. So something that was discussed with professionals last week and then also came up in the report was the idea of trying to, you know, generally raise awareness and not soloing out families or individuals to kind of say like, oh, we need to raise your awareness of epilepsy, but by raising the awareness of epilepsy and the complexity of it and the importance of it, and but also that young people, as Emily and many of us I've worked with have shown, can lead successful, brilliant lives for both children and their parents and other adults in the community, I think is really important. We talked about the spread of the kind of knowledge. So if you might, you know, if you do a piece of work to a community of parents in an area, you might educate or raise awareness of an uncle who has a niece with epilepsy, for example, and just by doing that, it raises that person's awareness in that community who can hopefully share that knowledge with their peers, especially in any particular communities of marginalisation. So that came up quite a lot. It's a really good idea. Again, easier said than done. And lastly, to increase the availability of accessible and simple technology. So again, I think this relates to both young people wanting to have something that they can easily log, something that links with a GP or their consultant or a nurse, but also parents wanting to have something quite simple that is epilepsy based to answer their questions, like an FAQ online. I know there's the NHS app, but it was discussed last week about how that is so broad. It's actually really hard to use efficiently. So that was some of the recommendations from young people. So I'm going to try and show another video. I'm going to do this because I think this will work. Of a young, so this is one of the videos we've had sent in so far for the videos we're creating. This is Spike, and he's shared his experience with us.
Nick, just to say we're not getting sound coming through our side.
Bear with me, everyone. How about now, Colin?
No sound. I'm still no sound. Can I just check you're ticking the... Oh, that's coming through now. That's great.
Epilepsy, and I've had this for about a year now. My diagnosis journey was very difficult, and I didn't get listened to by a lot of professionals because of my special needs. At the start of my diagnosis, I felt isolated and unable to do things. I genuinely had no idea what I could do and what I couldn't do. They weren't very precise on what my options were, and the support wasn't there. It was so uncertain. I didn't even know what epilepsy is, you know, and that is just like, it would have helped if there was a doctor there to tell me what was going on, and whenever they were speaking about me, they weren't talking to me, they were talking to my mum or whoever was with me, and that is just horrific. And they use the excuse that I've got autism to not like acknowledge me and completely overlook me and talk to whoever else is there like I'm not even there, and that is just like the worst. And I wish there was something that I could do to make people see that I am a person too, and I don't need to be spoken to like I am 4 years old just because I've got a brain injury and autism. That doesn't dehumanize me. I mean, it feels like it does, but it doesn't mean people need to just ignore me and make me feel like I'm 7 or something, and it's just horrific. And I just wish it could have been easier if people actually listened to me and spoke to me and communicated with me. But yeah, I'm persisting, and that's enough, you know. That's all I can really do, and hope for the best. So yeah, thank you. It's a pleasure. Great.
So that was Spike there, just sharing his kind of experiences of epilepsy care from the point of view of someone with neurodiverse conditions as well. And as mentioned earlier, you know, it's very much about that kind of understanding of their condition, and a young person being able to understand, does understand some of the things that are going on, and being maybe individualizing the treatment and the care that you give young people. And check in if they understand, do you want me to talk to you about these things as opposed to your parents. So I'm just going to start this again. Okay, we are nearing the end. We're going to do another Mentimeter. Excuse the slide rush through. Here we go. In a minute, and the question is going to be, what could you do to ensure the engagement of marginalised communities? So, you know, now with this very short 30-minute webinar, you should now have all the answers. Of course you don't, but I think what I'd just like to encourage is just some initial thinking based on today's session on what could you do maybe to try and engage young people in your communities who might not be getting the full access that they need because of various barriers or things that might be in place. So if you can go back to Mentimeter, it's the same number. So if you've still got it open, it should just refresh and such. And the question is, what could you do to ensure engagement of marginalised young people in your service/services? So, and the previous slides, there's several layers you can think of. It could be in your individual care, it could be in a service-wide care, or you could even think systematically from a national point of view. What could you do? So yeah, I'm just going to go to see what you're putting on. There you go. So www.menti.com, and the code is 74161026. Engage. How would you engage? Let's get some lamp. What would you do to actually engage them more, and what would you do to ensure their voice is heard? How would you do that? Use translators, interpreters. Yeah, that's always a good part. Speak to which communities? See if we can get more specific here. Publish translated materials, use appropriate communication tools. Yeah, video is really good at engaging, and then lots of written things were really important for lots of young people as well. Don't ignore them. So thinking specifically about marginalized young people as well. So, you know, kind of, so not just young people. So I'm talking maybe young people from a really specific poor, working class, socioeconomically deprived community, or young people from a Chinese community. And I'm being really specific because you have to kind of think about that sort of thing. Identify communities in your area and reach out to leaders. Nice. Yeah, that's great. Increase availability for young people to access talk. Think about specific groups to target. Try and engage young people group within your patients to improve care and get ideas. Utilize youth work, youth participation methods, yeah, or youth workers, dare I say. See what youth services already exist in your community. You know, it is about linking with other services in your community. I think is a really important or a really clever way of doing that. So whilst you're putting this down, and just before Q&A, I'm going to come back and ask Emily, whilst you're doing this, what, if any, advice you might have for professionals to engage hard to reach young people? Emily, do you have any, and it might be something that came up last week, or just some general ideas that you might have?
I think obviously you always want to try and engage verbally, but that's not always the best option, because sometimes, like we saw in that where we got the quote, it goes in one ear and it goes out of the other ear. And you kind of have to find your other little ways. For example, giving a 15-year-old a link to a website, the chances of them actually going to the link and actually looking through a website for 15 minutes isn't going to work. Whereas I think giving them a tag to a social media like Young Epilepsy, not to be biased, and telling them to have a look through there and connect with the social media on there. It's obviously a safe place because it's obviously recognised and all the facts are up to date. They're more likely to engage and get knowledgeable from there, so you know that they're getting information from a safe place and that they're being fed the right information rather than them trying to find their own sources. And I think you kind of have to try and engage the patient themselves. If they're not somebody who likes to be on technology, try find out what they like to do in their free time. If they like to read, I recommended a book to everyone last week in the session. It's the Lewis Hine Looking at the Stars. Highly recommend it to patients. That's a great way for patients to get involved if they prefer to read. It's just finding ways that you can't always win verbally, so to get them involved and kind of start accepting their epilepsy in another way and get information that's factually correct rather than surfing the internet and finding information that's wrong and then getting all these ideas in the head, and then they kind of create this really negative image. And I will say that kind of happened to me at times, and I thought, oh my gosh, it's all going wrong, and it wasn't. So I think you kind of have to look at how you can kind of figure it out.
Brilliant. Thank you very much, Emily. And it's really interesting, isn't it? I think as we've discussed when we met last week, and there's lots of barriers already potentially. As a youth worker myself, from a youth engagement background, there's young people that have barriers just for being a young person. Then young people who have been diagnosed with epilepsy experience barriers because of that diagnosis of epilepsy, and we've heard some stories from our young advisors about that. And then other elements where maybe your parents don't believe it's a thing, and I'm being very brash with that idea. So you don't necessarily, it doesn't get taken seriously, so you don't get to see health professionals as much as you maybe should be seeing them. Can have a huge, all these barriers have detrimental impact on your ability to look after yourself and also be looked after. So it's something about, someone wrote educated religious leaders. I think there's very much about finding out what communities are in your area, which I think someone put about identify. There we go. But then also finding out who the families, not necessarily just young people initially, but who the families listen to in those communities, and making links with them, because if it's coming from the people who they listen to, whether it be a religious leader or a respected youth worker or teacher, then it becomes easier for them to maybe have that conversation. Brilliant. So we're coming to the end now. We're going to have a Q&A. I just wanted to check, is the chat open, team RCPCH? We're going to have a 10 minutes for a Q&A. I'm just going to put our details on here. If you did want anything, then please do reach out. My email address is nick@ayph.org, and our website is www.ayph.org.uk. I'm going to now stop sharing my screen. So, it's back to Colin to help manage a bit of...
back to me. Thanks for juggling all that technology, Nick and Emily. It's impressive to navigate all those different things. And we've had one question through on chat. We'll see whether we can start getting a few more. Perhaps, Nikki, you can give me a thumbs up if the chat is working, but try it out and put your questions for Emily and Nick in chat. I've just a question to kick things off for you, Emily, and then maybe to Nick. We created these 2 sessions last week in Durham and Cambridge. I just wondered, Emily, how easy that was to do, to be someone who's going and speaking in a setting. Was it an easy thing? And if it was easy, what made it easy? If it was difficult, what made it difficult? I just wondered what your reflection was on that.
I think it's kind of something that you slowly get more comfortable as the session goes on, and you realise that everyone in there is actually to benefit you. I think after that first little icebreaker where you introduce yourself and everyone's like, oh, it's nice to meet you, it's kind of like, oh, this is fine, we're just here and everyone's wanting to talk about you. So it's very nice, and you can really settle down. And it's not, I think it's something that I'd encourage other young people to get involved in now, and without fear. I can't really say that I've got any relation beyond young epilepsy with anyone else that suffers from epilepsy to even recommend, but I'd highly put them forward to doing things like this now.
Yeah. And do you think it was as easy for others as it was for you? Do you think everyone shared in that, or that some found it more difficult than you?
I think maybe that's more individualized. I think it depends on how confident you are in opening up about your experiences. How open you are to answering questions, etc. And how happy you are to talk. Because obviously sometimes you have to talk more in more sessions than others. For example, this session, it's not required as much talking as in the last session, so it's been easier, dare I say. So I think it kind of varies, and it depends on the young person themselves, really, how happy they are to talk.
Yeah, thank you. So I'm seeing the chat's working now. I was a bit worried the questions weren't coming through, but they seem to be coming through.
There you go.
Okay now. So we've had one question here, and again, it's directed to you, Emily. Please, can you tell us more about which social media platforms we should point adolescent patients to? I think you mentioned Young Epilepsy, which is a link we can share, and I know they've got quite a few elements to their of support. Can you tell us what's good about that, or perhaps point us to other platforms that might be worth us thinking about?
We have Young Epilepsy and obviously Epilepsy Action, which I'm sure everyone in here has heard of. So I know they have their Instagram pages. I actually think they even have TikTok now, which is crazy. That's another big platform everyone uses, isn't it? And they're amazing. They post so many different resources, from just facts, and it's such easy information to read. You can just kind of have a scroll at your own time, at your own pace. They even post projects you can get involved without having to sign up to anything. Just, you know, have a read through, have a flick through. If you want to sign up just to a random project, a one-off, you can, no pressure. And it's really lovely if you just want a little part-time get involved type thing. I actually got that was my point of contact when I got diagnosed, because I wasn't into this whole website surfing thing. It really wasn't interesting. It was boring. So social media for me was kind of my call. But yeah, I recommend that.
That's great. And then
can I just add something to that?
Yeah, far away, Nick.
I think it's really interesting that we think of social media as the young people's game, and being a 40-year-old, I grew up with the rise of social media myself. And I think actually lots of parents use social media now far more than surfing the web. It's like it's 91. You know, so I think there's something about, in terms of finding out respected social media influencers for parents and families to look at as well. There's something about that in terms of raising awareness and stigma, myth debunking and that sort of thing. Always be careful of not everything on the internet's true, but you can, like you said, Emily, Young Epilepsy and Epilepsy Action, reputable sources.
Yeah, so have a look at the Young Epilepsy website. There's the Youth Voice Network, there's the channel, there's quite a few things to jump into there. And then a shout out, Emily. As Sophie said, she attended the Durham session. It wouldn't have been half the session if you and Ree hadn't been there. And then another voice that's come through, I can totally identify with young people with epilepsy being stigmatized and hidden away by their families, having come from a cultural background where this is the norm. Hopefully with more education, we can reduce this type of unhelpful practice. And then a question from Helen in Gateshead. You mentioned a youth advisory panel. I think this is a question for you, Nick. Any advice on setting up an inclusive local youth advisory panel, please?
Any advice? It takes a bit of time and a bit of patience and flexibility whenever engaging young people. Is that it's never a guaranteed thing. I think that's my first bit of advice from youth work in general. However, I think there's something about just setting up a group for initial from a peer support point of view to start with, of people that your geographical area might work with as patients. Inviting them to this social space where they might, I know this is such a cliche, but it works, where they might get pizza and snacks or play some games or get to meet other young people. And from that then forms or can form a youth advisory council. From an inclusive point of view, I think there's something very specific about, depending on who your patient, the demographics of your patients, and is proactively maybe putting in more effort to engage them in it. I'm going to be very potentially controversial, but generally in my experience of doing this work for 20 years, you put out a general call to your population, at least in the UK, you'll get a white middle class kind of will grab on that immediately. And other people, arguably the marginalised that we're talking about, might need an extra bit of information and a bit of hand-holding to convince them that it's something worth doing. and with attending and being quite general, but it is based on personal experience or professional experience, I should say. Yeah.
That's great, thank you. So I think I'm going to wind things up. I'm hoping people are restless and have things that they haven't asked and haven't done and haven't thought, and people feel they're going to go away needing to find out more and do more. I hope it leaves people feeling slightly uncomfortable but inspired. Nick, Emily, thank you so much for joining us today and sharing your work. And it sounds like we've got a lot more to hear and see from your work. So we'll look out for that. Thanks to Young Epilepsy and the RCPCH and AYPH for all their work in this space. After this meeting, we'll share future links so you can see this recording or some other outputs from the AYPH. And I think we need to do more, don't we? We need to hear what's not been heard. And I think all of us, this is quite a challenge. And you can't just wait and expect to hear the voice. You have to actively go out and release the voice. And for me, seeing the importance of youth workers to facilitate this has been really interesting for me because it's not a traditional professional group that I've come across particularly, and I can see they're real enablers, and the skill set is really good to help with things like forums and facilitations. So that's been really interesting for me. So I think that's me done. Thanks everyone for joining in. Really appreciate you joining in, and anything you do in this area, let us know. Successes, difficulties, please share the challenges, because I think this is just beginning. We've got a long way to go. So thanks everyone. Enjoy the rest of your day and your weekend. Thanks for joining us.